We're here today to outline a new approach to primary health care and everything that it entails, from first contact services by healthcare providers to health promotion and sickness prevention. We are here today because we are serious about health, the actual mental and physical well-being and health of the people of Newfoundland and Labrador. There are too many statistics showing that our province ranks among the most unhealthy in the country. That's not a legacy that any of us want to own. It's time for us to take control of our health, not only for ourselves, but for future generations. In the fall of last year, our government embarked upon a series of province-wide public consultations to ask citizens of Newfoundland and Labrador how we could improve primary health care, the essential everyday care. We visited communities all across Newfoundland and Labrador. We heard from people in each town. We heard from community groups and health professionals and healthcare experts. And let me tell you, they were frank with us. We asked them to really dig in and tell us what they thought was working well and what they thought needed to change. On January 14th of this year, Premier Davis hosted a summit on healthcare. Over 280 people attended and participated. Some of you are in the room today. These healthcare professionals, administrators, community groups, and citizens dug in to come up with solutions to the challenges we face in primary healthcare. Their findings are incorporated in the framework that we are presenting to you today. I'm fortunate to have the advice of a primary healthcare advisory committee who has worked diligently over the past 12 months to identify a vision and refine our goals and objectives. Many of you are here today as well. Thank you so much for your hard work. Without you, we wouldn't have this framework. The wealth of information we gathered has proven invaluable. It is leading us to a healthier Newfoundland and Labrador. I am proud to say that I believe this new primary healthcare framework will be the foundation for a healthier population and a more sustainable healthcare system. We will no longer own the label of being the most unhealthy in this country. We can turn it around, and we will turn it around. We have a lot of work to do, but this framework shows that we are up to the challenge. Our plan is a 10-year plan. Healthy people, healthy families, healthy communities, a primary healthcare framework for Newfoundland and Labrador, represents our vision for true change in the approach to delivery of primary healthcare services and supports in Newfoundland and Labrador. As we implement this framework, we will do a number of things. We will make sure there is better access to primary healthcare providers. We will ensure healthcare providers are encouraged to work in interprofessional teams. We will improve continuity of care. We will reduce staff turnover. And we will focus on preventative measures that are customized for individual communities. We've looked really closely at what other provinces are doing, and we factored the best of what we found into the development of this new framework. The framework will provide flexibility so that as we begin implementation, we will continue to identify more opportunities to increase access to services and supports in communities throughout Newfoundland and Labrador. We have to face the facts, folks. We as a population need to get healthier. We're aging faster than any other jurisdiction in Canada. In 20 years, 31% of us will be over the age of 65. In 20 years. The rates of chronic disease increase as we get older, but already 63% of the population have at least one chronic disease, such as arthritis, diabetes, heart disease, or cancer. These are concerning statistics. 20% of the population smokes regularly. This is the highest percentage in the country. That's not a statistic that we want to own. We have the highest rate of obesity in Canada. Almost 70% of the population of Newfoundland and Labrador is overweight. So without significant change and a vision for the future sustainability of our system, our province will face real challenges in maintaining existing levels of care, let alone improving our overall health as a population. So we need to reform primary healthcare services and supports to concentrate on promotion and prevention, and ensure that we invest strategically in the types of services that help us improve and maintain our mental and physical health. By working to maintain and improve our health, we can achieve better outcomes and reduce the burden of high-cost care that is required when we become so sick that we need to be admitted to hospitals or receive specialized care. Since 2003, the province's healthcare spending has doubled from $1.5 billion to almost $3 billion annually, and currently represents close to 40% of the entire provincial budget. When it comes to healthcare, we spend almost 30% more than the Canadian average, but unfortunately, we do not have significantly better outcomes. We need to look at where and how we are spending our healthcare dollars. As I've just said, we also face challenges when it comes to access. Residents in rural communities often face barriers to accessing certain routine services, and that's not acceptable to me. It's not acceptable to our government. One of the ways to address this challenge is better retention of our healthcare providers. We know that one of the best ways to improve retention is by encouraging team-based care. Not only is working in a team great for healthcare providers, but the evidence shows that this results in better health outcomes. The Honourable Roy Romano once said that a healthcare system, even the best healthcare system in the world, will be only one of the ingredients that determine whether your life will be long or short, healthy or sick, full of fulfillment, or empty with despair. The social determinants of health. The social determinants also matter in good physical and mental health and well-being. Factors like income, factors like education, factors like housing. That's why our government is working closely with a number of community groups, some of whom are represented here today, many others as well. Choices for Youth, Stella's Circle, the U-Turn Drop-In Centre, just to give you a few quick examples. We're also working with other government departments in the social sector. By increasing access to basic health and social services at the community level, we can deliver more supports to the people who need them, ultimately improving the overall health of our population. We have reviewed a substantial body of academic evidence from around the world. The evidence clearly shows that health systems with a strong foundation in primary health care are most effective in terms of outcomes and satisfaction, and they're also the most economically sustainable. So the primary healthcare framework that we're unveiling today includes 4 overarching goals. Number 1, engaged individuals, families, and communities, sharing responsibility for prevention, early intervention, and self-management. Secondly, individuals and families attached to a collaborative primary healthcare team. Third, timely access to comprehensive, person-focused primary healthcare services and supports. And finally, connected and coordinated services and supports across the health and social sectors. There are 17 articulated objectives to help us achieve each of these goals. We know we will not achieve our goals without ongoing collaboration, and that's really what this plan is all about. The framework presents a long-term, results-driven plan, and we will need to work with stakeholders to identify, develop, and implement tangible improvements. We have the good fortune of a positive working relationship with health professionals, experts, and community groups who play a key role in healthcare service delivery in our province. Their knowledge and experience has been a key asset in the development and ongoing implementation of this new framework. I am really proud to say that our work on primary healthcare reform and our collaboration with stakeholders, many of whom are represented in the room today, is already producing results. I am excited to tell you today that one of the first steps under the new framework is a focus on downtown St. John's. It's a new approach. I'm pleased to announce a new downtown healthcare collaborative that will bring together a coalition of health system and community partners, including the Department of Health and Community Services, Eastern Health, Memorial University's Discipline of Family Medicine, and a group of incredible community organizations, including Stella's Circle, End Homelessness St. John's, Choices for Youth, The Gathering Place, and the Salvation Army. This new downtown healthcare collaborative will focus on sharing resources to provide the right care from the right person, from the right healthcare providers at the right time. Together, we will enhance access to primary healthcare services and supports in the downtown St. John's area, particularly for at-risk groups, including those living with mental illness and addiction. The collaborative will work closely with Eastern Health to improve coordination among existing healthcare providers and allocate resources so that they better meet the needs of the people in the area who really need these services. 2 new family physicians and a street outreach nurse will work alongside the dedicated nurses, nurse practitioners, and social workers already serving the downtown area. These providers will receive support to work as a connected interdisciplinary team. A new electronic medical record will help providers work together, and individuals will have a single health record that can be viewed by any member of their healthcare team. I'm also pleased that a street outreach nurse position has been created to help connect those in need with vital care and supports as well. The outreach nurse will be shared between our new downtown collaborative and the Safe Harbor Outreach Project, or SHOP as it's sometimes known, which will improve healthcare delivery to sex trade workers. Ladies and gentlemen, we intend to learn from this new model of care. It will be subject to rigorous evaluation as we plan for improved healthcare models across the province. In addition to the creation of the new Downtown Healthcare Collaborative, we continue to attract and train more nurse practitioners and family doctors to serve in rural communities where they continue to be needed. We have partnered with Western Health, for instance, on the expansion of its chronic disease self-management program. Together, we're participating in a pilot project to bring Improving Health My Way to the communities of Ramia and Burgeo. Improving Health My Way is a provincially funded 6-week self-management program offered free of charge to anyone living with chronic conditions. The program consists of group sessions designed to help individuals manage their health and maintain active and fulfilling lives, despite the challenges associated with their chronic condition. We've also made huge strides with telehealth, and telehealth offers many benefits for patients, clients, and families, providing more timely access to healthcare providers and services, enabling care closer to home and family and social supports. Finding solutions for the delivery of more effective and efficient primary healthcare services to improve our healthcare outcomes. That's the primary purpose of the new framework. And I'm pleased to demonstrate today that it's already achieving tangible results, with much more to come. I want to thank everybody who has been involved in this new framework, including our Primary Healthcare Advisory Committee, health professionals, community groups, healthcare advocates, post-secondary institutions, and of course the people of this province for their honest opinion and thoughtful suggestions throughout the consultation process. You're all to be commended for your ongoing dedication and hard work. Your contributions to date have been tremendous, and I believe the best is still yet to come. Building a healthier Newfoundland and Labrador is definitely not going to be easy, and this announcement is definitely not intended to be a quick fix. Successful implementation of this requires ongoing partnership, it requires ongoing collaboration, and it requires cooperation. As the Deputy Premier of this province and the Minister of Health and Community Services, I truly believe that primary healthcare reform is the answer to better health outcomes for both our physical and mental health challenges and improve system sustainability. But let's put that aside for a moment. On a more personal note, and like so many of you in the room today, first and foremost, I'm a parent. And just like you, I want my children to be happy and I want them to be healthy. I want my children to grow up with good access to primary health care, no matter where they choose to live in our province. I want my children to develop healthy habits for both their physical and mental health so that they can live happy, healthy, and productive lives right here in Newfoundland and Labrador. With this framework, I believe this is something that we can achieve, not just for my kids, but for everyone. I'll say it one more time. We will meet this challenge. I want to thank you for your participation in this process so far. I'm really excited about the possibilities to affect change when it comes to primary health care reform in Newfoundland and Labrador. Today is a bold new beginning, and I really want to thank all of you who've been part of the journey so far. I'll now turn it over to Dr. O'Shea, who is representing the Newfoundland and Labrador Medical Association today. Thank you.
Good afternoon. I'm a family doctor in St. John's for 33 years, and I'm the board chair of the Newfoundland Labrador Medical Association. It's my honor to be here today representing the Newfoundland and Labrador Medical Association to mark this positive announcement. We welcome this new framework, which supports our shared vision for a better primary health care system in the province. It is our hope that this vision will guide primary health care reforms to result in long-term sustainability, improved quality of care, and greater access for patients in their communities. If we do this right, we can reduce growth in health spending, improve collaboration between all primary health care providers, address challenges with recruitment and retention, and most importantly, improve health outcomes for patients. Doctors intend to be at the forefront of building a stronger and higher quality healthcare system for our patients. We will play a key role in achieving many of the objectives outlined in the framework. In fact, we spent the past year working with the Department of Health and Community Services to develop innovative approaches to primary care reform. Last year, the NLMA and the Department of Health traveled to British Columbia to see how reforms in that province have improved its primary care system. This inspired the NLMA and government to negotiate a new program for primary care renewal within our recent agreement. We agreed to a consensus-based process for developing programs that will enable family physicians to participate in system reforms. We need to involve everyone who has a stake in the delivery of primary health care in this province. This framework lays the foundation for cultivating the type of interprofessional collaboration we need between all stakeholders so that we may identify challenges and work together to develop meaningful solutions. The evidence is clear that when allied health providers work as part of a team, patients receive better management of chronic illnesses, they spend less time in hospitals and emergency departments, and they receive better follow-up care when they are discharged. At the same time, governments also receive better value for their health care dollars because patients are seen at the right place at the right time and by the most appropriate provider. I would like to commend Minister Kent for defining how primary health care reform can be achieved in this province. The new Downtown Collaborative announced today is an example of the type of primary health care system we all want. Now we need to build on this. The NLMA looks forward to working closely with the Department of Health, the regional health authorities, and all members of the Primary Health Care Advisory Committee to begin turning this vision into reality. Thank you.
Registered nurses and nurse practitioners have long advocated that health and wellness starts with individuals, families, and communities, and that's the whole basis of this framework. So as I stand here today, I'm pleased to see that we haven't lost sight of this very important concept, philosophy, model. You can use any word to describe primary health care, but at its heart is there for the people, the communities. Through the years, ARNNL's commitment to primary health care hasn't been kind of quiet. It's been one of our common threads through all our pre-budget submissions, all our discussions, all our meetings with different departments. It's also, though, been evident in our approach as an organization working in coalitions. We have worked with the Newfoundland Labrador Medical Association just most recently on the tanning beds work. We've worked with the Lung Association on looking at smoking cessation. We've certainly worked with multiple partners around increasing breastfeeding rates. So the fundamental premises of health promotion and health wellness, which is the goal one, is something that we've embraced for a long time, and we're excited now that we can elevate it at the provincial level. We're also very pleased to say we've been a part of the government's Primary Healthcare Advisory Committee, and we've certainly had voice as an organization and as the registered nurses and nurse practitioners around the province in the Healthcare Summit and in the focus groups. We were there, we spoke. And through this primary healthcare framework, we truly believe that government is leading transformative change in healthcare. We believe that this model has the potential And I think Dr. O'Shea said it well, there's a lot of work to be done, but it has the potential to increase the capacity to significantly improve health outcomes, build the capacity of our people, which is fundamental, and our communities, and ultimately help sustain our healthcare system. As nurses, like the other healthcare providers that are in this room and that are around the province, we apply a holistic lens to practice, and we believe engaging and supporting individuals and communities in identifying solutions to improve health and wellness is, as an old quote would say, a resource for everyday living. Anybody else who can age themselves to EP? We already have, as a nursing profession, we have 500 community health nurses, 135 nurse practitioners, and that's just in the front lines, because primary health care expands all settings, all places. Right now we're talking about community, but it has a role in acute care, so we'll get there. So we're really pleased about the framework today, because I think it offers that 10-year vision of where we can roll it out. It really demonstrates government's commitment to continue to invest in programs that support this holistic approach. And for that, ARNNL, on behalf of the registered nurses of this province, applaud you and government. Nurses are well prepared and excited to embrace this model that has been a part of our nursing education system and the way we frame nursing practice for years. Utilizing that experience, knowledge, and skills, we look forward to working collaboratively with other members of the healthcare team to improve population health. Even more exciting, as the framework explores the goal of timely access, enhancing the utilization of all healthcare providers in expanded service models is an exciting opportunity. We are pleased to be able to offer our expertise to build a more responsive system that helps ensure quality outcomes. So in short, ARNN certainly is committed, and the nurses and nurse practitioners of the province are committed to working with government of Newfoundland and Labrador to advance the health and well-being of the people of our province, strengthen the provincial healthcare system, and improve access to quality health at the community level. We look forward to seeing the framework take shape in our communities.
End Homelessness St. John's is a collaborative itself. And I think there's something magic about collaboratives that work well together. So I'm really pleased to see that this is taking its first steps as an infant, as a collaborative on several shoulders in the community. And we know we can grow that team. And to me, therein lies the seeds of transformative change in our community. Because we actually can't say where it's going to end up. It's going to follow a path that the people of our community, including people who have faced health inequities, and have been excluded from health services just because of the way systems are designed and also because of the particular circumstances in their lives. It hasn't been a happy marriage, as you can see. So specifically, in our work, we know that housing is a key determinant of health. And we also know all too well that homelessness and housing instability undermines people's health and can even be deadly. And too often, the lack of the right supports at the right time, as the minister said, can actually cause homelessness or sustain it. So you get a double whammy social problem happening. So this is an opportunity to take, to go back on the road and to take it in a different direction. So this is why, as we work with our partners to implement the St. John's Community Plan to prevent and end homelessness for the more than 800 individuals who experience homelessness in any given year, and the thousands more who are experiencing housing instability, that we see this population as being one of the target populations to receive services through this downtown healthcare collaborative. If it's not designed in at the front end, sometimes these things can become afterthoughts. So I'm so glad to see that happen. So I really don't have anything else to say except that I think we were counting on the days too, and when we met with you, Minister Kenton, earlier this year, and we talked about it, and we've been working with your team feverishly since then. The physicians who are putting their time towards this, the Eastern Health, Memorial University, and our community partners who provide homeless services in our city. Everybody stands ready to make this thing grow. So we're just excited to see it happen, and now we roll up our sleeves and the real work begins. Thanks very much.